Hi, good morning Marvin. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 30th of January 2024. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Marvin Don.
Alright Marvin, could you please confirm your candidate number?
Yes. My candidate number is 432334238.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Can you share your experience from nursing school that you believe has prepared you for this role?
During my time in nursing school, I gained hands-on experience through clinical rotations in various departments. One particular experience that stands out is my rotation in the medical surgical unit, where I developed strong patient assessment and communication skills. This exposure equipped me to handle diverse patient needs and work effectively within the healthcare team.
How do you prioritize and organize your tasks, especially in a fast-paced healthcare environment?
Time management is crucial in nursing, and I learned to prioritize tasks by urgency and importance during my clinical rotations. I utilize tools like to-do lists and prioritization charts to organize my duties. Additionally, I always maintain clear communication with the healthcare team to ensure coordinated patient care and address urgent needs promptly.
How do you handle stress and pressure in a healthcare setting?
Nursing often involves high-pressure situations, and I have learned to manage stress by staying calm and focused. I practice self-care routines outside of work to maintain a healthy work-life balance. In addition, I have found that maintaining open communication with colleagues and seeking support when needed is essential for coping with stress effectively.
How would you handle a situation where you made a mistake in patient care?
In the event of a mistake, patient safety is my top priority. I would immediately report the error to my supervisor and the healthcare team, take responsibility for my actions, and collaborate on a plan to rectify the situation. Learning from mistakes is crucial, and I am committed to ongoing self-improvement through feedback and continued education.
How do you stay updated on current healthcare practices and advancements in the nursing field?
I am committed to staying informed about the latest developments in healthcare through continuous education and professional development. I regularly attend workshops, seminars, and webinars to enhance my knowledge and skills. Subscribing to reputable nursing journals and participating in online forums allows me to stay connected with fellow professionals and learn from their experiences. Moreover, I am enthusiastic about seeking opportunities for further certifications and training to ensure that my practice aligns with the most current and evidence-based standards in nursing care.
Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Good afternoon. I'm Nurse Marvin Don, and I am here to assist you in the emergency department. May I know what brings you here today?
Hi, Nurse Dawn. I've got this really bad headache. I got hit with a football, and now it's pounding.
I'm sorry to hear that. Don't worry, we are here to help you. Could you please tell me your full name and age for the records?
My name is Mihiraa, and I am 23 years old.
Thank you for the details. Mihiraa, have you experienced any physical symptoms, such as nausea, vomiting, blurred vision, or anything else?
No, just the headache. Nothing else.
That's great to hear. Now, let's get some basic information. Can you tell me about the incident in detail, Mihiraa?
Sure, it started about a few hours ago, right after the football hit me.
Okay. Mihiraa, on a scale of 1 to 10, with 10 being the worst pain you've ever experienced, how would you rate the pain?
I'd say it's about a 7 or 8.
All right, thank you for sharing that. Have you tried anything to relieve the pain, Mihiraa?
Yes, I took some paracetamol tablets, that's it. But it didn't relieve my pain.
Okay. I understand. This must be concerning for you, Mihiraa. You will be all right. I appreciate you providing that information. It's crucial for us to understand your situation thoroughly. Now, let's summarize the details for confirmation. You're here due to a severe headache that started a few hours ago after being hit with a football. The pain is currently around a 7 or 8 on a scale of 1 to 10, and you've experienced no other physical symptoms, such as nausea, vomiting, or blurred vision. You've attempted to alleviate the pain with paracetamol, but unfortunately, it hasn't provided relief. Is that right?
Yes, it is correct.
Thank you for the confirmation. We'll make sure to include all these details in your records. Mihiraa, I would like to explain the next steps of your treatment now. Following our discussion, the next phase involves a series of careful steps aimed at ensuring your well-being. Firstly, you may undergo a clinical observation, where our medical professionals will closely assess your condition. Depending on the situation, there might be a need for diagnostic procedures, such as X-rays, to gather more comprehensive information. After this initial phase, you will be guided back to the waiting area, where we aim to keep you as comfortable as possible. Subsequently, you will have an examination by one of our experienced doctors, who will carefully evaluate your condition. Following this, we will collaboratively decide on the most appropriate treatment plan for your specific case. Throughout this process, your comfort and understanding are our top priorities. But first, do you have any questions or concerns?
Okay, I understand. But can't we just do the X-ray now to be sure?
I understand your concern, Mihiraa. However, at this moment, I must resist the request for an X-ray, as it falls outside the scope of my role. Please be reassured that our doctor will be consulting with you shortly to thoroughly evaluate your condition. Based on the information you've shared, there are no apparent physical symptoms or signs of distress, and there's no immediate risk of bleeding. It seems that the pain you're experiencing is a result of the force from the hit. Our medical team is dedicated to providing you with the best care possible, and the decision regarding any diagnostic procedures will be made in consultation with the doctor. If you have any concerns or questions, Mihiraa, please feel free to express them, and we'll do our best to address them.
Okay, I guess that makes sense.
Great. Now, before we proceed with the clinical observation, I need your consent. Is it okay if we start monitoring your condition?
Yes, that's fine.
Thank you, Mihiraa. I appreciate your cooperation. We'll get started with the observation, and the doctor will be with you shortly to discuss the next steps based on the findings. If you have any more questions or concerns along the way, feel free to let me know.
Thank you again. I will. That is the end of your OET speaking role play. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.